Okay, so today, whatever the remaining portion that is from the unit 1. So today, let's see to how much extent we can complete. So today we will be like discussing about that. So before starting today's topic, so I would like to ask you all regarding the previous chapter or topic that we have discussed. So what was the definition of first aid? What was the definition of first aid? Manas? Manas, what was the definition of first aid? If you can't answer, I'll pass this question to Siti. Yesterday only I sent the notes very nicely with the colorful I have sent, but still you can't say. Even if you can't say without looking, say with looking. Manas, can you hear me? Manas, can you hear me? Okay, Manas is absent then. Okay, Balo, can you hear me? Siti,
Yes,
can you hear
ma'am.
me? Siti, can you hear me?
Yes, ma'am. Yes, ma'am. Yes, ma'am. I can hear you, ma'am.
Balo, can you please tell me the definition which I have sent yesterday?
Immediate treatment to person
Yes.
who is injured or suddenly, ma'am, or become illness.
Yeah, you say the full.
And facility materials and illness facility materials.
Then?
And illness facility materials, ma'am.
That much I give you all.
Not, ma'am. No, ma'am. I own the definitions, ma'am.
Okay, okay. Okay, Siti, can you hear me? Okay, Balo, thank you. Siti, can you hear me? Yamang, can you hear me? Yamang? Please don't waste time. Can you hear me, Siti? Okay, leave it. Carly, can you hear me?
Yes, ma'am.
Carly, can you please tell me the true principle of first aid? Principle, only two.
Restoration, respiration, and control bleeding.
Okay, very good. Okay, so today the remaining portion we will be continuing. Okay, like I'll show you all the screen. Can you see the screen?
No, ma'am. Yeah, yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, just wait a minute. Can you see?
Yes, ma'am.
Okay,
Yes, ma'am.
so today we will be discussing about the another topic, okay, from your syllabus, that is golden rules of first aid. Okay, this is also something that you cannot make up. So that is golden rules of first aid. So let us see one by one. What are the golden rules or the important rules of first aid that we could see? So number 1 point is do first, think first, quickly, quietly, and without panic. That means this is the first rule, okay? That this is the first golden rules that we need to follow. So, and the first thing we need to do that, like if we find someone, some injured patient or anyone like any illness, so first, whatever step we need to take is that we don't we should not try ourselves to take step, or means we should not like make ourselves take step in delay. Okay, like don't delay yourself in taking any step. So whatever like illness that you have seen, okay, so you have to take a quick action. First action you have to take, and you don't need to be in hurry. You have to take quietly, okay, and without panic. Panic nahi hona hai. Like whenever you find someone sick or any kind of illness, then you have to like do all these things. You have to follow these rules. Okay, this is the first rules. And then coming to the second, we have to reassure the casualty and his relatives sympathetically. So reassure, we have to reassure the casualty, okay? Carly, what is casualty?
The patient, ma'am.
Okay, the injured one, okay? Okay, we have to
Yeah.
reassure the casualty and his relatives sympathetically. What is sympathetically? Any one of you?
With
Always
kindness,
try to
ma'am.
be the, like, you know, always try to be the one who always give the first answer. Sympathetically. What did you say?
With kindness, ma'am.
Yes, very good. Okay. So we have to reassure the casualty and his relatives sympathetically, okay? With kindness. And then coming to the next point, we have to look for the following. So what are the following like rules that you need to look forward? So is there any failure or if is there any failure of breathing? If yes, start artificial respiration. So these are the points that you have to look, okay? These are the golden rules of first aid. So if there is any like difficulty in breathing, if there is any like shortness of breath, okay, shortness of breath is also known as like difficulty in breathing. So in that case, what happens is that you have to quickly start artificial respiration. So you know now what is artificial? Artificial.
Yes, ma'am.
Yes.
Yes, ma'am.
What is artificial?
Ma'am, the thing which is made by people means which is not natural and
Yes,
which is
very
just made
good.
in
Yeah. Okay. Very good. That is, which is not like naturally we breathe, is not it? So when this ceases, okay, when this stop, okay, when there is any like disturbances or when there is any blockage in our like breathing pattern, and in that case, what we do is that we use this artificial respiration. So to bring back the person like to bring back the person into his normal pattern of breathing. So we have to use this artificial respiration. So these are the things that you have to look forward. So again, the next point, is there any failure of circulation? If yes, start external cardiac massage. So you have to also look for the following, okay, that is there any failure of circulation? So what is circulation? Circulation.
ma'am, sir, like the circulation of blood and means it's just a flowing of something.
Okay, good, very good. That means you all have idea, right? So if there is any failure of the circulation, then what you need to study is that you have to study external cardiac massage. So what is external cardiac massage? Anyone?
Aiding the heartbeat, ma'am.
Pardon, like you can speak. What did you say?
Aiding or helping in the heartbeat, ma'am.
Aiding or helping in the
That-
heartbeat. Okay,
Yeah,
partially correct. Okay, partially correct. Anyone else? You can share your point of view.
Massage
But
to
if
cause,
there is
ma'am,
any failure of blood
to pump
circulation.
blood.
Yeah, say.
Massage to the heart, ma'am, to pump blood to the rest of the body, ma'am.
Okay, very good. Okay, anyone else would like to share? Anyone else? Anyone else? So what is the main, like, what to say? What is the main, like the main objectives or the main aim of this external cardiac muscle? It is like what happened is that it mainly causes the heart to pump, okay? The heart to pump blood, okay? To other parts of the body. So this is the process that they perform, okay? So when there is any failure of circulation. So these are also the things that you have to look forward, okay? This is the second important point. First was the any failure of breathing, and the other one was any failure of blood circulation. So are you clear with this point?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay.
Yes.
These are the like simple one. Okay, next. Is there severe bleeding? If yes, stop bleeding by pressing on the pressure points. Press firmly on the bleeding area with a clean pad and keep on pressing the bleeding area for at least a few minutes. So this is also another like third point that you have to look. Okay, so you have to look if there is any severe bleeding. If yes, then your main aim is to stop the bleeding. So in order to stop the bleeding, so what you need to do is, what you need to do in order to stop the bleeding, it's written. What do you need to do? Read the point. And, yeah.
Press the point, ma'am.
Pressing on the
Pressing on the pressure point, right?
Pressing
What is
our point.
Yeah, what is pressure point? What is pressure point? Because you want to stop the bleeding, it's not it. For that, you have to press the pressure point. So you need to know what is pressure point. What is pressure point?
The place from where blood is coming out, ma'am.
The
Place
The
from where
place
the
where
it's not audible, I think, like network problem. Yeah, you say again,
it is the place
The
where
place or
from
the
where the blood
point
is
or the
coming
area,
out.
right? The
Yeah,
place,
ma'am.
the point or the area, okay? Where there the bleeding have been like, where there is the area or the point where excessive bleeding occur, okay? That particular point, you have to press it, okay? You have to press it, that area for at least a few minutes, okay? At least a few minutes, you have to press it. And you don't need to like press deeply or hardly. You have to press the pressure point very firmly, okay? Very firmly you have to press it. By doing that, by doing in that process, it will help the person like it will help the person stop the bleeding, okay? So this is the like third point that we can look for it. So coming to the number 4 point, we have to avoid handling the casualty unnecessarily. So what does this mean? We have to avoid handling the casualty unnecessarily. So what does this mean? Anyone? Number 4 point. 4 point में क्या बोला है? We have to avoid. Kostov, you have any idea?
Ma'am, the seriousness should be avoided. Means, ma'am, the patient is we should avoid to think about the.
Okay, Kostov, no problem. But you have idea, right?
Yes, ma'am. Yes.
Okay. Then Balo, can you please explain number 4? Balo.
ma'am, avoid the cold. Avoid the unnecessary
Yes.
cold things, ma'am.
Okay.
Cold things, ma'am.
Okay. Jeevan, please explain to your friends. Jeevan, please explain to your friend.
Yes, ma'am.
Yeah, explain to your friend number 4 points.
We have to avoid the movement, ma'am, of the casualty of the patient, ma'am. And
Yeah,
we have to handle it with care, ma'am.
Yeah, very good. So this is one of the like golden rules, okay? Like we have to handle the casualty with very carefully, okay? We don't need to handle that person or the like injured person unnecessarily. Means like just with soft, with calm and care, you have to handle. That is what this number 4 point says to us. So number 5, we have to arrange for the safe removal of the casualty to the care of a doctor or hospital as soon as possible. So I hope this no need to explain, you know, we have to arrange for the safe removal of the casualty to the like care of a doctor or hospital, okay, as soon as possible. We have to arrange this, okay. so that like the casualty before it get delay, okay, you can like transport or you can like consult to the like doctor, okay, or to any kind of hospital which is being nearby as soon as possible. So like immediate action or immediate arrangements should be made. That is the 5 points, okay. So let us like revise again. So what are the golden rules of first aid? These are very, very important for your exam, okay. So the first golden rules was we have to like we have to do the first thing first, okay. So first thing first ka matlab hai ki you find bleeding, okay, someone is bleeding so much, so like you in that case what happened is that you should like firstly try to stop the bleeding, okay, instead of going and doing unnecessary thing. So this is the first do first thing first ka matlab ye hai. And then quickly, quietly, and without any panic. That was the first point we already explained. And then we have to like reassure the casualty and the relative, okay, with soft and calmly. And then all these things we have to look for the following. First, once we have to look if there is any failure of breathing का कुछ सांस लेने में कष्ट है क्या, सांस लेने में प्रॉब्लम है क्या, वो देखना है. If there is any problem, तो उसको artificial respiration देना है. Next is there any failure of circulation? अगर blood circulation में कुछ problem है और कुछ failure है, तो what you have to give? You have to give a massage, external cardiac massage, okay? We have to give this. और उसके बाद is there severe bleeding? Bleeding हो रहा है लेकिन वो bleeding बहुत ज़्यादा severe है, means the bleeding is very, very much deep, okay? It's very, very much very severe. And in that case क्या करना है? You have to press the pressure point, okay, the area from where the bleeding, like the bleeding comes out, okay, or the bleeding flow. So in that area, like you have to first clean it with the pad, okay, any kind of pad, the sterile pad, any kind of pad. It might be a gauze, whatever is available. With that you have to clean, and then you have to press it little for a few minutes to stop the bleeding. And then also you have to avoid handling the casualty unnecessary. अच्छी तरह handle करना है, like with like calm and careful, okay. You need to be very careful in handling this. And then we have, and also lastly you have to arrange for the safe removal of the casualty, okay. You have to arrange the safe removal to care for the doctor and any kind of nearby hospital, health center, all this as soon as possible. You have to arrange all these things. So these 5 points are the important golden rules of the first aid. So are you clear, all of you?
Yes, ma'am.
All of
Yes,
you?
ma'am.
Okay, if I ask you, will you be able to say?
Ma'am, can you explain the 4? Avoid handling the casual unnecessarily.
Yes, explain. Oh, you want me to explain?
Yes, ma'am.
Oh, avoid handling the casualty unnecessary means now, like what to say, means like so suppose someone is falling from the like building, okay, from a huge building, like suddenly someone is falling down, and then like there is an excessive bleeding from his head, okay, there is excessive bleeding or from any part of his body. And at that time what happened is that you are trying to carry that that injured person, okay, you are trying to carry. So while you are trying to carry, you have to carry that particular like injured person very carefully, okay. It's not like you have to touch here and there the bleeding area, you have to press it like this. It's not like that, okay. So what it indicates here is that don't just unnecessarily touch the infected portion, all those things. Just you have to handle carefully. That is what it means. बस ऐसा समझो कि अच्छी तरह हैंडल करना है. Understand?
Yes, ma'am.
You want to
Ma'am,
explain?
this
Yeah, say. We have to keep on moving on. Say.
ma'am, these things we have to take a screenshot or you will share, ma'am.
No, I will share everything. I will give you this one. Yesterday, how I give the PDF, right? The same thing I will give today also. Is it okay?
Yes, ma'am. Yes, ma'am.
Okay. Okay, next, the most important thing. This is like, today you have the practical class also, na? So this is the same topic we will be discussing this only. So first aid kit items. So anyone have any idea? First aid kit items? First aid kit box में क्या क्या होना चाहिए? Any idea?
Ma'am, Dettol. Ma'am,
Yes.
Dettol also. Ma'am, cotton.
Yes.
Ma'am, any type of medicine.
Okay. And
Bandage.
okay.
Bandage, ma'am.
Say, keep on saying.
Tweezers.
Okay, let us see one by one. Okay, that means you all have a little bit idea about this. So a basic first aid kit may contain. Okay, so let us see one by one. Plaster in a variety of different size and shape. So these are the things that you have to see. So do you want me to explain along with the picture? Yes or no? Do you want
No,
me to
ma'am.
explain along with the picture? Do you want to see the picture? For example, I have said plaster in a variety of different size. So do you want to see the image as well?
Yes, ma'am.
Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, that thing, like,
Yes, ma'am.
okay, that thing, I think for now there will be no time, but after that again I have a class with you all. Now in your practical class I will be showing you all. So this, let us discuss what are the basic first kit that we can find. Okay, number one is plaster in a variety of different size and shape. So these are the like things that you need to keep. Okay, plaster, in plaster also there is a different size. Okay, all those things you need to keep under this first aid kit. And then small, medium, and large sterile gauze dressing. Okay, so small, medium, and large sterile gauze dressing, this is also the items, okay, which is necessary to be kept in the first aid box. So what do you mean by sterile? It can simply be written, right? Small, medium, and large gauze dressing. But in the middle, it is mentioned sterile. Is sterile का मतलब क्या है? What do you mean by sterile?
Clean, ma'am. Uninfected.
Pardon?
Clean and uninfected.
Clean and?
Uninfected, not infected, ma'am.
Yes, which is free from all these bacteria, all microorganisms, totally clean. It's not sterile. Okay, so
Yes, ma'am.
the sterile thing we kept openly, or it is kept under the package or under the any like container, or it is just kept openly, the sterile items? Anyone?
Kept in a package, ma'am.
It in a package or in a container, that means it is kept closed. No, it is not kept open.
Yes.
So all those kind of like sterile gauze dressing, you need to have, okay, in your first aid kit box. So I'll show you all this in the pictures. And you have to have at least 2 sterile eye dressing. Have you ever seen sterile eye dressing? Sterile eye dressing?
Bandage, ma'am.
A bandage kind of, but there is like eye dressing. Okay, there is like the product is there. So I'll show you all later, no problem. Just try to know, for now you just try to know what things are inside the like first aid kit box. Okay, later on I'll show you all the picture. So you have to have at least 2 sterile eye dressing. Okay, there are lots and lots, but at least do rakhna hai first aid kit box mein. And then there is a triangular bandages. So have you heard the triangular bandages? Bandage to suna hoga, lekin triangular bandage suna? You heard about this triangular bandage?
No, ma'am.
Okay, I'll show you all picture later on. Just try to memorize now, okay? And then the crib roll bandages for wrapping and bandaging injuries. So have you ever saw this crib roll bandage? Crib roll bandage.
Yes, ma'am.
Okay. So much of sound. Okay, these are also the things. Then next is band-aid of all sizes. I hope band-aid to sabko pata hai. Everyone know what is band-aid, right?
Yes, ma'am.
Yeah, band-aid of all
Yes, ma'am.
sizes. Okay, safety pin. All of you know safety pin?
Yes, ma'am.
Okay, so safety pin, and then again there is a 4x4 gauze pad for cleaning wounds. Okay, wounds. when you try to clean the like wound, okay, at the time what we mainly use, gauze means बहुत सारा gauze होता है, हाँ, अलग अलग size में you can cut it. You can cut the gauze into like small, medium, large, okay, it depends. It depends on how you want to use it. So when you try to clean the wound, okay, at the time the like the inches or the centimeter that you need to have is 4 into 4 gauze pad, okay, 4 into 4. I'll show you all the picture this. So in this slide you could see all those things, okay. So let me repeat again. Plaster, अलग अलग size का plaster, उसके बाद small, medium, large sterile gauze dressing, and then you need to have at least 2 sterile eye dressing, and then triangular bandages, and then here crib roll bandage and band-aid of all sizes, safety pin 4 into 4 gauze pad for cleaning wounds. So are you clear with all this? All this point?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay, let's move on. So the next is disposable sterile gloves. So, oh, Jiban, please take attendance, okay? Only 10 minutes left. Okay, disposable sterile gloves. So what do you mean by disposable? What do you mean by disposable? क्योंकि फर्स्ट एड बॉक्स में रखना है ना, डिस्पोजेबल स्टेराइल ग्लव्स रखना है, तो डिस्पोजेबल का मतलब क्या है? व्हाट इज द मीनिंग?
Single use item, ma'am.
Yes, once you use and then you threw it, isn't it? So that is known as disposable. And means एक बार यूज कर लिया तो दोबारा यूज नहीं कर सकती. That is known as disposable. Okay. So next is cotton ball. Cotton to every one of you know, no need to explain. Cotton ball bhi rakhna hai. And then like tweezer. Have you heard the term tweezer? Tweezers. Have you heard?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Tweezer also you need to keep, okay? And then again next is scissor. Scissor to sabko pata hai, no need to explain. And then alcohol-free cleansing wipes. So this also, you know, I think most of the time people used to carry, I think, wipes and all, na, to clean your like face or whatever it is. So all these wipes, alcohol cleansing wipes also, like you need to have in your first aid kit box. And then sticky tape, all this sticky tape also, you know, I think tape jo hota hai na, alag alag type ka tape hota hai na, like transparent tape, black tape, different sticky tapes are there. All those also you need to have inside your this first aid box. And then next is thermometer. So have you heard the term thermometer? Anyone?
Yes, ma'am. Yes, ma'am.
Yes. Thermometer is mainly used for what?
Ma'am, fever. Ma'am, for measuring the fever.
Yeah, for okay, it's good, it's good. Okay. Thermometer. That means thermometer are of different like types. Okay, thermometer alag alag tarika ka hota hai. Like one is the clinical thermometer, and then the other one is the digital thermometer. Okay, digital thermometer nowadays only it is being used, but those days, okay, in those days we mainly use clinical like thermometer, which is needed to be deep inside the Teflon solution or else Dettol solution. So, and then the other one is skin rest cream such as hydrocortisone or calendula. Okay, there are like different kind of like cream. Okay, if someone face any like skin problem, or if there is any rashes in his or her skin, then what happen is for emergency we need to have like some kind of cream. Okay, and the name of that is hydrocortisone. Okay, or else calendula. So these are just an example. It's not that for the skin rash you have to apply this hydrocortisone only. It's not like that. It's just an example. So all these things also need to be kept inside the first aid kit box. And the other one, cream or spray, okay, to relieve insect bites and sting. So there is also a cream or a spray, okay, to relieve insect bites and sting. So agar like suddenly if insect bites you, okay, and at that time you always need to have some emergency cream or emergency spray, okay, in order to relieve. Okay, next, antiseptic cream. So antiseptic cream, बहुत सारा antiseptic cream होता है. Antiseptic cream, Dettol, Teflon solution, all those things also need to be kept. okay, in this first aid box. And the other one is painkiller such as paracetamol agar fever वगैरह हुआ या फिर headache, okay, in all those cases we have to like this always carry this paracetamol, okay, or infant paracetamol for children, okay, and as well as aspirin and ibuprofen. So all these are the like painkiller. If someone asks you what is the medicine mainly given for painkiller, then you can just say it's paracetamol, aspirin, and ibuprofen, okay. So aspirin is not to be given to children under 16. So aspirin is given to the children, but it is not given to children who are under 16 years of age. So 16 years ke baad hi like ye de sakte hain. So and then there is also an infant paracetamol, okay. Infant paracetamol, how you will know is that the dose decreases, okay, like there is a like 500 mg, like 650 mg. So depend on your age, you will be like given. And then or ibuprofen.
Crocin is much better, or the paracetamol is better, ma'am.
What? Pardon? Say again. Say again.
Ma'am,
What
for fever purpose.
What's your question? Please say again.
Ma'am, for fever purpose, ma'am, the paracetamol tablet is much better, or the crocin advance is better, ma'am?
Oh, actually, that will depend on your this one. That will depend on your temperature, your fever. You will be like what to say? You will be checking to the thermometer now in order to know the degree or the centigrade or the percentage of how much the person is having a fever now. So based on that, the medication will be prescribed. So it's not that that paracetamol is more effective or the one that you mentioned is more effective. It's not like we can't just say. It will depend on the temperature. Temperature high, jada high ya low hai, that will depend, okay? And that will be prescribed by the physician, by the doctor. Physician means the doctor. Is it okay?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Oh, okay. So next is the cough medicine, okay? Cough medicines. Cough medicine also there is like the tablet is also there, and the syrup is also there, right? Alag sa syrup bhi hota hai. For example, like we mostly used to take is that Benadryl and all those things, cough medicine, which is very, very common. All this you can just carry it. And then antihistamine cream or tablet, and then distilled water, okay? Distilled water for cleaning wounds, ORS, that is oral rehydration salt, okay? And then eye wash and eye bath. So all these are the items that you need to like carry, okay, along with you, or you need to have inside your first aid box. So I want to explain the details about it, but there is only 2 minutes left. So we will continue along with the picture on your next class, okay? That is your practical class. So Jiban, are you done with the attendance?
Yes, ma'am. Done.
Okay, okay. After 10 minutes, you join the class again, okay?
Okay, ma'am.
Okay, ma'am.
Okay.
Thank you, ma'am.
Okay, for now.
Thank you, ma'am.
Okay, ma'am.
Thank you, ma'am.